This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
No, we did not retire. In case you were wondering that we weren't here last week, no, we didn't. So,
John, come on, tell the people you were on vacation.
We're going to leave this program in a box, I guess.
You're the best,
but,
John.
Anyway, good morning and welcome to another edition of Health Watch. Every Sunday we're here 8 till 9 on Talk Radio 1210 WPHT, and Health Watch features Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And as always, we talk about the who, what, when, where, why, and how of Innovative Medical Associates, how they can help you and anyone you know improve your overall quality of life. And we take your questions, and possibly if you have a health challenge, you want to run it by Dr. Molly, feel free to do that here in the studio. We're here for the next hour. 855-839-1210 is the number, 855-839-1210. Anytime during the course of the program, if you want to call in, feel free to do so, 855-839-1210. And as always, Dr. Molly, it was good to be back, but I missed the treatment for a week. So
but you did pretty well. We saw you coming in. I feel like your overall energy level seems to be back, John. So I'm thrilled. I'm really thrilled. And you're doing well. We just got to keep going, you and me.
Yeah. Well, you do feel. I mean, I feel it. Like I miss that. If I'm not there twice a week, so
sure.
It was just different,
Sure, but you know what? The idea is, I want to improve your quality of life. That was a quality of life trip you took to see nephews, nieces. That's what we're all about, John. So I'm glad you missed us. But again, like I tell people, I don't want to go steady with you guys. I just want to help you, right? That's the bottom line.
Okay, so speaking of health, what do you do?
Well,
what is Innovative Medical Associates all about, and what is your philosophy?
So John, we are a like-minded group of practitioners who actually have work out of my facility, which is a primary care facility. So therefore, we can do anything anybody's other primary care doc can do. Just yesterday, actually, we had to order a Z-Pack for a patient, and it was a Saturday, of course, and Dr. Pat ordered the Z-Pack. She said, yeah, order it. We need to do it. She's in trouble. Do it. So the bottom line is, if you need a pharmaceutical, we can order that for you. But it's really the philosophy that we want to utilize the least amount of pharmaceutical to correct your challenge and improve your overall quality of life by reducing the side effects, not only from the condition, but from the medication.
And, of course, there are side effects.
Of course.
Because every time you go to the pharmacy, you get a book with a prescription.
You sure did.
And I've never read it, but
don't.
Sure.
Don't.
It's just unbelievable.
It is.
But are there any side effects with
Sure, there can be some side effects, but generally they're much less and less severe. And on top of that, if you use them properly and you use them in the right manner for a particular patient, and you deliver a therapeutic dose, which we do utilizing the hydration therapy, then you got it made.
So what is the least amount?
Well, it depends on what we're trying to correct, John. For example, we use vitamin C. You know that. We use vitamin C. This patient that we called the Z-Pack in, we asked her if she's feeling a little better on Monday or Tuesday to come on in and get some vitamin C to augment what she's doing with the Z-Pack. So, again, it's going to be a certain amount for that patient with whatever's going on, whether she has a viral. She actually, it was bacterial in this case, and we knew it was because we got some blood work back on her just that same day on Friday, and I was trying to reach her, and here she ended up coming down with it. So the bottom line is this. If you have a problem, there's therapeutic method utilizing natural substances that may enhance your quality of life. We don't talk about cure, John. We can't cure things. But can we do your overall quality of life, make them better, make you happier? Absolutely.
What conditions do you find your protocols work best?
Well, certainly we use a lot of protocol, including a lot of the hydration therapy for autoimmune, which are chronic conditions where people have things like arthritic conditions, skin conditions. Maybe our medical director has MS. These things that actually can be pretty detrimental for our health in the long run, but they are chronic and ongoing. We do a great job. I have a tremendous amount of cancer supportive therapies that we are using here. I'm actually getting pretty skilled with a lot of the lung therapies, COPD. We can actually help people reduce some of their COP meds, which, by the way, talk about a litany of side effects. Unbelievable. So, again, it depends on the patient, it depends on the challenge, and it depends on the protocol. So, we can help most everything within reason, but the most that I see are things that affect our immune system, conditions like cancer, chronic conditions like rheumatoid pain, and lately we've been doing a lot of mental health.
You have over 600 protocols.
We do.
They're your recipes, and it's proprietary, and we
know
that.
Sure.
But the likelihood that you can help somebody is very high. With that being said,
it is, because listen, I'm in this 27 years, and believe me when I tell you there's a whole litany of hydration therapy protocols out there, but to us that's the primer. That is just the basis. What we've done is enhance these protocols. And how did we do this? Trial and error. And I will tell you, most of that trial and error was done on ourselves.
Yes.
We did all our own R&D, and that was a very expensive process. Plus, John, I think it's important that people understand that my supplements, my nutraceuticals, the injectables, are very, very specific, and I know what they're made up of, where they come from, and I'm telling you, John, our homeopathics the same way. So we're very particular. We're very different than spas and very different than people that tell people, well, you can get a Myers cocktail. God bless Dr. Myers for inventing that 50 years ago. But that was then, man. This is now.
Yes. It's interesting. You were mentioning, some of the things that you do, and I know that you don't sell any particular product.
Not usually.
But you have given me a product
is
not available in this country.
Well, it is available in this country, but it's not really known.
Yeah,
okay, that's the key.
Yeah.
Okay, in this case,
and it really has been very, very helpful.
Sure.
But if I didn't know you, how would I know it?
Well, generally, you would hope maybe one of your physicians heard about this, did the research on it. But I will tell you, the reason why I like that particular product, and again, we don't sell much, as you know. We don't have a private label on things. The reason why I like that is this is an iron supplement that is so well put together. It's actually an Italian recipe, and it actually works where it doesn't give the patient constipation and it doesn't upset your stomach because of how it's digested. So, and I read all the data on it, and it's unbelievable for children as well as adults.
Managing expectations is also a big part
tough.
of and I know that's tough. What do you tell people, and what can they expect getting started?
Well, I think the most important thing is to come in for the free consult, something you talk about often, and bring me as much information as you have. And that includes bringing me your medication list as well as maybe your nutraceutical list. And generally, I find that people have a lot more information than they think they do. And many times they bring me a lot of paperwork or send me some things ahead of the head of the free consult, which I don't mind as long as they book the free consult. Like I went through a chart, I mean about 50 pages for someone, and then I found out that he booked somewhere else. So, that, of course, took my time, and I don't want to ever take my time from my patients. So if you're, and this is for the free consult, I want you to hear, not to come in and start a program. But it's very important that I get the data from the patient, and most of it, I like to hear your story. I want to know what brings you to me. What's your chief concerns, right? And how can we help you along those lines?
What do most people tell you? What does bring them to you?
You know what, John? Most people are frustrated with the conventional medicine today. And I'm not talking about all the new protocols that are out. I mean, my God, there's just so much new science out. But actually just getting your appointments, working your way through the maze of specialists. And I'll tell you, it's frustrating for another healthcare provider. So I know it's extremely frustrating for my patients. So we tried to help them eliminate some of that frustration. But I tell you, it is huge. But if they come to me with challenge, I would say the top three are the cancer challenges, the immuno-enhancing things that they need to do for chronic conditions, and also pain, and lately mental health, definitely depression.
Do you have a protocol for mental health?
We absolutely do have a depression protocol that is working unbelievably.
Can you say a little more about it?
Well, yeah, I can say that we use a repurposed medication as well as some tried and true nutraceuticals that are very delivered. All of this, by the way, is delivered through the hydration as well as possibly some spray, nose spray for a patient, that kind of thing. But again, this has to be done very specifically with an understanding the actual problem and understanding the type of depression a patient has.
We are coming up on our first break of the morning. The program is called Health Watch, and we're here every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Again, the number here in the studio, if you have a question or a medical challenge you want to run by Dr. Molly, 855-839-1210. That's the number, 855-839-1210. Dr. Molly and I return with more of today's Health Watch after these words. Operators standing by right now at Innovative Medical Associates, and their number, 856-489-0505. I'll give it to you again, 856-489-0505. What you got to do, really, this is very, very simple. You call and you set up your initial consultation with Dr. Molly. It is complimentary, and you find out a lot about your condition, your problem, and how Dr. Molly potentially can help you. It's really simple. All you got to do is make the call, 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. And our program is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly is available to you right now via this number, 855-839-1210. That's the number here in the studio. So if you have a medical challenge you want to run by her right now, 855-839-1210. We're going to do what we call in the business a tease, Dr. Molly.
Hey, you're surprising me, John.
This is called, you have something called 7 minutes can make a difference in your life.
You're right.
And
you're right.
It's really, I walked in on this. And,
he did.
Everybody was reading notes and say, so the lovely Linda, she let me know. This machine is fabulous. I guess.
This instrument is fabulous.
Yeah, so,
you guys know that I was at a conference a few weeks ago, and of course I'm very excited about a new instrumentation that I'm implementing in our facility. And this instrument is done with electrodes, it's non-invasive. but it's a 7-minute scan, and we're going to be using this a lot for certain types of autoimmune conditions and some other things. And it really is going to give us some data, and it does it all in 7 minutes. Now, that doesn't mean Dr. Molly and the doctors interpret. That's when the data is delivered to us, right, via the computer system. But we have to then study that. But the idea is, John, it's going to even help me become more accurate, more precise about patient problems, because you may come to me with what you think is the challenge. And I do a lot to discover really what the real challenge is. But this is just another tool in our black bag to help us get more accuracy to that and more precision in the delivery of what we do nutraceutically. So if you can get that, it's going to be quite a thing. In a couple of weeks, we're actually going to be up and running. And, I'm very, very, I spent the money for this because I think it's going to be something, a wave of the future. And you know me, we like to be on the cutting edge. So I think that people are going to find it quite interesting. And I'm sorry, because it took 10 minutes out of your time by the time I sent one of the nurses back out there for you.
That's all right.
But you were having some fun, too, talking to people out there who were being tended to. But the question is, you're right, you walked in on it. So we're just completing. We have to do this in steps, and I want my my people to be very well versed in this before we start using it on patients.
Would you say this is the most innovative and probably the best thing you've done?
In a while, I would say it ranks up there with a few things. It ranks up there with things like I used in terms of the radio frequency, in terms of the light therapies we have, which people, we don't get a chance to talk much about this, but if any of my techs are out there listening, hopefully they might want to call in, our nurses. The bottom line is we have a lot of things in our toolbox. Yes, hydration is the main vehicle by which we effectuate the change, but there are a lot of helper things that go with the hydration therapies that may indeed help a patient.
We'll keep you posted on the unveiling of this. It's coming in a couple of weeks, so stay tuned. 855-839-1210 is the number here in the studio. We're going to talk about cancer support and some testing and
sure. Here's the thing. In the last few weeks, I've had many more cancer supportive patients who've come in to see me, and they all come in with different times in their cancer journey. So I like to really get as much data as I can from them, from their oncology people, whatever. And sometimes it's hard to do, but what I realize is that just about everyone who comes to me hopefully has had the biopsies done. And then I look for some other types of testing that possibly they had done and they don't even know they've had it done. So some of the things I found is that, for example, they don't really realize, but on their biopsies, what's being done is there may be a genetic test being run on the genetics of the tumor. Why is that important? Well, it's very important because it can give both the oncologist an idea of which chemotherapy. Sure, there are standard chemotherapies, but maybe my particular patient might have an oddball one. I like to read those along with my docs as well. Maybe point out something and say, well, what about this particular gene sequence in this? It can be affected by such and such of a chemotherapy. But more importantly, we can use that and look at what nutraceuticals affect that particular gene protocol.
So that's another tool.
Right. It's another tool in our box. The other thing I want to talk about is people have really gotten hip on these liquid biopsies. And so really you have to really understand what they do. Some liquid biopsies can detect mutations, which can shorten the traditional treatment time and also again help us by pointing out the mutations in the genes that may be affected, let's say, by green tea. That's just something I'm throwing out. But we also need to know, is there signaling? People who've had cancer, this is an interesting thing. People who've had cancer before, and we know they've had bona fide breast cancer, something like that. We may want to run a test that is actually a screening test. And you would say, well, Dr. Molly, why do you want to run a screening test on someone who's already had cancer? Because I want to know if the signaling of that cancer is no longer active. And are we looking at cancer signaling as well? So it's different than a liquid biopsy, but it may get lumped in that because it's a blood test. Do you see what I'm saying?
Yes.
So these are very particular things, and you want to look at them and use them correctly and not think you lump them all in the same category. That's my point. This is tricky, but all of this can help not only the conventionalists do what they're doing, but if you go to an integrative physician, this is why we are not a spa. If you go to an integrative facility like ours, we need to look at this and see, okay, what particular, we all know, everybody says, well, I'm going to get high dose vitamin C. Okay, that's great. What else can we do to help you with your particular cancer? And there's a load of it. Yes, inflammation is the culprit, but what particular anti-inflammation nutraceuticals will work on this particular cancer?
There are many tests that you do.
Yes.
Can you kind of walk us through
some of them
in layman's terms? Some of them.
Well, I would say, for example, there are so many tests, and unfortunately we don't have TV here, but if you look at my chart, and this is a chart right out of my notes, okay? For example, you can do traditional testing from places like LabCorp and Quest. There are plenty, they're doing cancer markers, okay? And each particular cancer has a list of cancer markers that you're looking for. And what is that? That's the shedding of the DNA proteins into the bloodstream. Now, that is a true cancer test. For example, in breast cancer, you might look at something like the CA15-3, the CA2729. And again, don't get worried about the numbers, folks. These are just test numbers that people look for certain proteins. For GI, we might look at CA19-9. But again, these tests do not take the place of good clinical data. In other words, you've got to trust your oncology people. And if and we, of course, I have a consulting oncologist who I call on when I have a question about particular patients. And everybody talks about the BRCA. You've heard that for the breast. Yeah, BRCA is important because that's a genetic test. So you can see there are various testing for each and every type of cancer. But again, the cancer signaling is really brand new. Aggressive cancers tend to release more cell-free DNA into the bloodstream at early stages and are more likely to have a signal really detected from this particular test we use.
So how do you know which test to use and which is going to, how do you match this up?
Okay. It's not simple at all. Okay. First of all, you don't want to repeat tests that are going to cost an arm and a leg for the patient. What you want to do is see what's already been done, if anything. Now, sometimes a patient comes to us first, and maybe, we hear that they had a history of cancer. Well, in that case, we probably would use the test that detects the DNA shed in the blood by developing cancers. Why? Because he's already been treated and it's arrested, so they think, and there's no other problem. Guess what? If that cancer signal comes back that there's a problem, you can be sure that we're not only going to tell the patient, we're going to request the DNA testing on the particular cancer in the beginning. Does that make sense?
Yes, it does. Yes.
So there's a lot to be done, John.
Okay, we are at the halfway point of the show. Time flies when you're having fun. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Number here in the studio, 855-839-1210. We still have plenty of time left on the show to take your calls and your question or your medical challenge. 855-839-1210. Dr. Molly Fantasia is here, and I'm your host, John DeMasi. We both return with more of today's edition of Health Watch after these words. Operators are standing by right now at Innovative Medical Associates. And if you want to call and make your appointment for the initial consultation with Dr. Molly, very simple, 856-489-0505. Again, 856-489-0505. When you call, again, make sure you book your appointment for the initial consultation with Dr. Molly, and that's really where you're going to get all the information you need as to whether or not you want to make a decision to move forward with the treatment at Innovative Medical. 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210, WPHT. The number here in the studio, 855-839-1210. We are going to kind of wrap up this test, what you were talking about, testing.
And testing in cancer patients. And I think it's important that cancer people understand that these diagnostic, quote-unquote, tests are used for many different things. So initially, they're used to see the primary disease, okay, what type of cancer is it, and also to identify if you have any subtypes of that particular cancer. That's very important for treatment, both conventionally and also integratively or the holistically that we use. Predict the prognosis of the condition. And again, I tell people it's a good thing to have some of the data in terms of that, and also to evaluate the treatment response. So, for example, you may want to do a test to make sure that the treatment that we are doing, meaning the alternative treatment, is also helping them lick the cancer and helping them in their progression as they move through their cancer journey. And it's very, very important that we do this. And of course, it's important to just screen people in the beginning and all through the treatment protocols with us, that we know if there are changes, we catch them right away, and we would help guide that patient back to the conventionalist if that's where they want to go. And again, you know, John, I have people, I meet the patient where they are. I have a patient who will only do the surgery. I have a patient who's doing both the surgery, chemotherapeutics. I have patients who want to do the chemo and not the radiation. And guess what? We meet them exactly where they are, and we want to help them through that journey no matter what they choose to do.
So you're testing all the way through the treatment,
correct,
right?
Correct.
You're testing in the beginning, you're testing maybe in the middle.
Right. And ongoing, no matter what. You're a good example of that, actually. Very good example of that. And that's the important piece. So that's all I wanted to say about this. It's not so cut and dry. You want to continue to monitor where you are, because my belief is, listen, you know, we don't just have cancer in this moment. We probably have cancer. It didn't start yesterday, and it isn't going to be cured tomorrow. Period.
All right. 855-839-1210. That's our number here in the studio. 855-839-1210. A very, very good story. And this just really sums up why you have Dr. Molly in your life, why it's important. You're going to tell the story of Joan.
Sure.
And what has happened to her in the course of the treatment.
Well, absolutely. Okay. Joan has been a long-standing patient with us, and she was doing very, very well. She had a reoccurrence actually she had an additional cancer that developed besides the primary. And as I said a few months ago, I guess, I spoke that she went up to a very prestigious university setting, and the interventional radiologist called me and said how good she looked, and he was able to radiate the area that was affected in the brain. And indeed, he's called me since then, actually. I haven't said that, to say that he was very happy with her progress. So she's back, and she never missed a treatment with us, by the way, all through the radiation. And now she's on an oral chemo in addition to the radiation, which was suggested by her oncologist. So this past week, this is her third week on the chemotherapeutic, she said, Dr. Molly, I'm just going to give up. I really only have 2 more weeks on it. I really don't want to do it. And I said, well, Joan, I read the status on this, and I really think you should continue. It's only 2 more. I can't. She said, I cannot take the nausea I have when I take this particular drug. I said, well, why didn't you speak to me sooner? And she said, well, yeah, everybody's asking me how am I doing and everything. She said, I don't think to put 2 and 2 together. I said, well, it's important. Well, guess what? My nurses got into gear. We put together an anti-nausea IV, as well as sent her home with some of the anti-nausea things to inject. Guess what? She called me and said, I can't tell you, I can finish this and I'm feeling pretty good. And the oncologist said, I look pretty good. I said, yeah, you do. So that's the story. And what I'm saying is there are many things out there that we can help people through their traditional treatments. I don't want people to think that they can't do their traditional just because they want to do, quote unquote, integrative or holistic. No, they can work hand in hand and maybe even help you get through it.
You know, it's a fascinating story. And by the way, this Joan, I know she comes an hour and a half.
Oh, yeah, she's from North Jersey. That's right.
So, I mean,
she could be in New York. She could go to New York.
That's right. Mm-hmm. That's right. But can you talk about what you did, how you did it, without giving away any secrets?
No. Well, I guess what we did was we take into consideration where a patient is and what can we give her in her IV that not only can help her energy, her quality of life. Listen, there's nothing worse than being nauseous. And I'll tell you another thing. I'm looking more and more, we have a weight reduction program. Everybody's on the bandwagon for the weight drugs, right?
Yes.
Well, there's an interesting article that came out this week in reference to that about the nausea that people are having. Well, okay, there's traditional anti-nausea medication that can be given. Well, guess the best way to give it?
IV.
One of the ways is IV. Imagine augmenting that with the homeopathic. Honey, we can take you through this so that you don't have the nausea that you would have with the injections. And I think in that regard, in fact, a gentleman who is my patient, he came to me and he said, oh, I'm getting my weight drug now that I went through your 4 weeks. I'm getting it from my primary. It's covered by my insurance. I said, God bless you. He said, oh, but I'm having terrible, terrible nausea. I said, well, you didn't have that when we gave you the weight drug, right? Which, by the way, we compounded it, so it was purer, I'm sure. He said, no. I said, well, didn't he give you anything for the nausea? No. I said, well, go back and talk to him. Yes. What can I say? You know what I mean?
Right.
I mean, these are some of the things that I'm up against, John.
We have a phone call. It's one of our favorites, Frank in the Northeast.
Oh, my
Frank,
gosh.
Good
Frank.
morning. Welcome. You're on Health Watch with Dr.
Hey,
Molly.
I haven't heard from you in a while, Frank. How are you?
He's been on vacation too long.
Yeah, not me. Hey, man, I'm still at my desk and on the clinic floor. John, I got John feeling so good. He's on vacation. It's good. It's great.
I know last week he double dipped. He was on vacation on Saturday and on Sunday.
That's right. That's right. Well, he had to go. Yeah, hey, listen, he was in beautiful California. So,
Really?
Imagine, he took that flight. He did well. I'm proud of him.
Well, Dr. Molly, many things. I was going to call at 8:54, but I decided to be nice to John his first day back. I don't want to, get a little nervous the last minute calling in.
Oh, my goodness.
But about a month ago, Dr. Molly, John, the pharmacist from Bucks County,
yes,
he hit the nail right on the head. He called you the GOAT, the greatest of all time.
Oh, he's a sweet guy. He's a wonderful guy. I love my compounding pharmacists. Go ahead.
Yeah, he's great. I like what he calls him. But about 6 months ago, I finally realized what a GOAT stood for. I would hear it occasionally on a TV show. I never knew what they were talking about.
Greatest of all time.
Mm-hmm.
About 6 months ago, I finally realized what it was. Why do they call people goats all the time? I never knew it. And when John said that, I'm like, I know what that stands for. But Dr. Molly, I loved you for a long time. But what John, the pharmacist, said, you are the greatest of all time.
Aren't
Seriously.
you the sweetest? Thank you, John.
And South Philly High should have a day named after you, Dr. Molly.
Oh, no,
Day.
please.
But seriously, every kid get the Bunsen burners and the beakers, go down there and teach them how to make aspirin or something like that.
Yeah, you know what? I got to thank the wonderful teacher I had, the wonderful science teachers I had, because they actually sparked this in me, and I thank God for that. I have to tell you, Frank, I'm grateful. I'm grateful for people like you because, you help me keep me thinking. I'm always thinking about how can I help? And I think that's the bottom line. I mean, the whole clinic, my whole facility, I believe, are first and foremost in our minds every day. With God's help, we say, what can we do to make life easier for our patients? And that's the truth. That's it. I mean, we really love our patients, and that's just not a saying or a slogan. We truly, truly do. We take every case personally.
I know that. And about, what was it? Oh, that new diagnostic tool you're talking about?
Yes.
Is that called RM3A?
No, you're gonna love this. But you listen, the minute I have it up and running, I'll love to run one on you. Okay? That's a deal.
Last time I saw you was Ash Wednesday. It was also Valentine's Day. I'm still working on getting over that. I will be there.
I know.
Also, one more thing, please.
Sure.
If Pam's listening, one of your patients.
Oh, yeah,
her
she's
son,
wonderful.
I believe his name is Shane.
Sean.
Please give us an update.
Yeah, Shane, yes, that's right.
Shane. The Future Cy Young Award, who's he playing for? And let us know, please, Pam and Shane. We care about you. You're part of the family.
All right.
Have a great one, Dr.
I hope she calls
in.
She'll happily call in about her
Right.
not so little boy. He's a wonderful kid too, by the way.
Okay, we are coming up on our final break of the morning. It is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. We still have time to take your calls, 855-839-1210, but you better call now, 855-839-1210. That's our number here in the studio. It's Health Watch with Dr. Molly Fantasia, and I'm your host, John DeMasi. We both return. More of today's show after these words. Back here on Health Watch, operators standing by right now, and they will be there well after we leave you at 9 o'clock. 856-489-0505. That's 856-489-0505. And when you call, you want to set up that appointment for the initial consultation. It is complimentary, 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. We're going to go to the phones right now here on Health Watch. It's Michelle on the line. Michelle, hi. You're on Health Watch.
Hi, Michelle. How are you?
Hi. Good morning. Hi, Doc. How are you doing?
Good. We're good. How are you doing? That's important.
I'm doing better, but I just wanted to call in and tell your listeners that, if anyone is having any kind of medical issues like I was and they're not getting any kind of results, that they really should seek you out and come visit you, because you got me to a point where at least somewhat, at bay a little bit.
I hope you continue to be at bay. You have no idea you're on our prayer chain. You know that. And I have to tell you something interesting. I'm sort of glad you called today and I have a minute to talk to you. You and I talked about this. Autoimmune issues and histamine and mast cell productions and things that cause this are very, very difficult. But the one thing I would say about you is you never gave up, and I really respect that, Michelle. And of course, you heard me say, go to the biggest and the best. I have no problem with that. And I really hope that that is helping you. And please, I want you to know that our door is always open to you when you're finished any conventional, whatever. And I really believe there are more things that can be done now that we have a bona fide diagnosis.
Right. Absolutely. Yeah. I mean, I'm glad. I truly believe that you got me to this point where I had to go to the next step further.
Sure.
And kind of keep things to where they're at least manageable and not as bad as they were last year.
Thank God.
That was hell.
Thank God.
But it's just learning to live with it and dealing with it and trying to keep it under control and.
Doing what you have to do. Right. Exactly.
Right.
And that's true for a lot of conditions. The idea is to learn to live with it and try to have some quality of life in between.
Michelle, good luck with that.
God
thanks
bless.
a lot for the call. We
Thank
really
you.
appreciate
Thank you.
giving us an update.
Thank you.
The mayor of Germantown is on the line. Joe, good morning. Welcome.
Hey, Joe.
Good morning, John, and good morning, Dr. Molly. And my prayers for Michelle as well.
Thank you.
You're welcome. Was that Frank they called before Michelle?
Yeah. She's the best.
My man Frank. Thanks, Frank. Always good to hear from Frank. Real quick, Dr. Molly and John.
Yeah.
Oh, go ahead. I'm sorry, Dr. Molly. I didn't mean to interrupt you. I'm sorry.
No. You go ahead, Joe.
Yeah, I just want to say a couple of things real quick. You know, I try to tell a lot of young people, because they look at me, they call me an old head because I'm 62, and they be telling me, and let me tell you, these are kids of all races. They think it's cute when they vape, right? They say, well, OG, I'm not smoking cigarettes. I said, but it's just as bad. I said,
yes, it is. Yes, it is.
I mean, they think it's cute. I be seeing some beautiful young people of all races. They be smoke come out of their ears, their mouth, and they think that's cute. And I be trying to tell them, I see just as bad as smoking a cigarette, but they think it's good. They said, yeah, but I'm not smoking cigarettes. I said, but it's just as bad. Oh my God! It's like,
first of all, hey Joe, you know, you're 62. Right. You know, you're a baby compared to Dr. Molly and I.
Yeah, that's right.
So
that's right.
You're a kid.
That's right. But you know what? These kids, I'm with you. You know how many times I've got all this vaping. I mean, I don't understand. I don't understand.
Dr. Molly. And they think it's cute, and they try to justify it by saying, but it's not cigarettes. I said, you might as well be smoking cigarettes. You may as well.
Doesn't matter.
Let me tell you something. It's worse in some respects. Exactly. So you know it. And you know what? God's given us this beautiful body, but if we don't keep it up, I'm telling you, we got trouble. We really do.
I agree. And Dr. Mike, last thing real quick, I was thinking about you and John, because, you know, it's the establishment. They always taking shots at healthy stuff. For example, I heard a report, I'm sure you and John saw it too, where they said, don't, watch taking fish oil and stuff like that, because it might cost. I mean, it's always some negative stuff when it comes to natural homeopathic remedies. It's always some negative. But it's when they show those commercials about taking these different things for these diseases. Now they'll tell you the side effects, and act like it's no big deal. They'll say, well, if you take this medicine for your A1C or whatever like that, it can cause possible fainting, vomiting, and even possible death. They'll say things like that, and it's like it's no big deal, but yet they'll take a shot, a cheap shot at krill oil or either fish oil, vitamin C. They kill me in this country. That's why I thank God, Dr. Mo, for people like you and John, because y'all truly are blessing, because y'all let people know we're not trying to get you off your medic if that's what your doctor prescribed, but at the same time, y'all give another way. Y'all put a balance out there that you can have that if that's what you have to take, but you can have also natural remedies too, like hydration, things like that. You know what I mean? That's why I appreciate you, Dr. Molly, you and John. I do, because y'all bring a balance to the situation.
Thank you. Thank you, my friend.
And we are unfortunately out of time, Joe.
You're the best, Joe. God bless you.
Thanks for the call. We appreciate it.
Thank you.
That is going to put the wraps on another edition of Health Watch. Don't forget, operators standing by right now at Innovative Medical Associates, 856-489-0505. That's 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And if you missed any of today's show, we're going to have our Health Watch replay this afternoon, 4 to 5, right here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, our nursing staff, Barbara, Lana, Donna, Vicky, Jess, and Daniel, and then, of course, there's Joanne, Delightful D, Fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thanks for listening. We'll do it all over again next Sunday, 8 till 9, Health Watch, here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.